Hi, it's Dr. Charles Modlin, your friendly urologist, here with another Health Equity Brief. Again, the Health Equity Briefs are an opportunity for me to relate to you, the listening audience, important information that I think is important that you individually, as well as your family and community, know to help maintain and improve your health. And today's topic is going to be on a very important topic. Even though we're in the middle of the winter right now, before you know it, summer is going to become upon us. And with summer comes swimming in swimming pools and lakes and going to the beach. And the topic of today is disparities in fatal drownings among African Americans. Very important topic. It's not something that we talk about a lot. Not everybody is aware of that there's remarkable disparities in the incidence of fatal drownings, especially in African Americans. So let's get into it. Drowning is a significant public health concern in the United States, with critical disparities evident among racial and ethnic groups. African Americans, particularly youth and adults, experience higher rates of fatal drownings compared to their white counterparts. This health equity brief examines the contributing factors to these disparities, including the historical context. It's important to know the historical context so we can understand why this is occurring now. The historical context includes systemic racism and socioeconomic conditions. And during this brief, we're also going to propose some solutions to improve swimming safety and within the Black community and education within African American communities about this glaring disparity. So let's get into the statistics. According to the Centers for Disease Control and Prevention, drowning is the leading cause of unintentional injury death among children ages 1 to 4 years old. Who would have known that? And it's the second leading cause of death in children aged 15 to 14 years old. That's CDC data from 2022. Research indicates significant racial disparities in drowning rates, with African American children being, get this, 5.5 times more likely to drown than white children. That's 2020 data. Similarly, the CDC reports that while drowning rates overall are declining, African American adults, particularly those aged 30 to 54 years old, have a higher mortality rate from drowning compared to white adults. These statistics highlight the urgent need to address underlying causes of these disparities. So what are some of the contributing causes? I touched on it earlier. The historical context of segregation is a major factor. During segregation, African Americans were systematically barred from accessing public swimming pools and recreational facilities. Laws and policies enforced racial segregation, limiting opportunities for swimming lessons and safe swimming environments for African Americans. This historical context has had lasting effects on swimming proficiency among African Americans. We did touch on that in one of my podcasts about a year ago, Music and Medicine. That's MUZIC, Music and Medicine. You can go to Spotify, type in Music and Medicine, or type my name, and you can actually hear an hour-long conversation on my podcast about fatal drowning. So historical context of segregation, of socioeconomic factors. We do know that economic disparities contribute to limited access to swimming facilities and swimming lessons. Many African American families may live in neighborhoods without safe access to water, recreation, or resources for swimming education. It's 2021 data. Cultural factors and family influence. Studies show that if the parents do not know how to swim, their children are also less likely to learn how to swim. This is particularly pronounced in African American families where generational knowledge of swimming may be lacking due to historical barriers. Racism and redlining. Systemic racism and policies like redlining have historically restricted African Americans from accessing quality recreational spaces, including swimming facilities. It's resulted in fewer opportunities for swimming education, lessons, and training, safety training. So what are some of the proposed solutions? It's important to talk about the problem, but we always want to propose solutions. So some of the solutions are the following: developing community-based swimming programs, establishing free or low-cost swimming lessons in community centers, particularly in areas with high African American populations. This can help increase proficiency in swimming. Collaborations with local organizations and schools can facilitate access. Culturally relevant education, developing culturally responsive educational materials and programming can engage African American families. This includes highlighting the importance of swimming as a life skill and addressing historical barriers. Funding and resources, increased public funding for swimming programs in underserved communities is essential. This can include investments in public pools, training for instructors, and scholarship for youth, and particularly training for instructors who have cultural competency and diversity and inclusion training. Public awareness campaigns, launching targeted awareness campaigns about drowning risk. These statistics and swimming safety can help educate African Americans about the importance of swimming education. Then we get into advocacy for policies that will support all of the above potential solutions, advocating for policies that promote equitable access to recreational facilities and swimming education is crucial. This includes supporting initiatives to eliminate barriers to access and ensure that public swimming facilities are safe and inclusive. So, in conclusion, the disparities in fatal drowning among African Americans are multifactorial, multifaceted, and they're related and rooted in historical injustices, systemic racism, and socioeconomic barriers. Addressing these disparities require a comprehensive approach that includes community engagement, targeted education, and systematic and policy changes. By implementing these solutions, we can work towards reducing the fatal drowning incidents and promoting health equity in swimming safety for African Americans in all communities. Very important topic. It's that time of year. There are multiple resources where you can access swimming instructors. I know the YMCA is, they give lessons that when I was younger, my siblings and we took lessons at the YMCA. But again, just become aware of this problem. Fatal drowning, I've seen some statistics that black teenagers have a 10 to 15% 10 to 15 times greater incidence of fatal drowning than their white adolescent counterparts. So until next time, please like and share this health equity brief. Spread the word, pass the word along. We have to educate ourselves. We have to become proficient in swimming. I know a lot of times, I've even heard jokes of how black people can't swim. It's not a joke. This is not a joking matter. Until next time, I'm Dr. Charles Modlin. I'll see you for the next health equity brief. Thanks for being here.